Ministry of Health described the current drug shortage the country is experiencing as acute. Speaking in Lilongwe, Health Minister Catherine Nkhani said the Central Medical Stores Trust stockout level is currently only at 5%. She added that Treasury had assured her ministry of funding to procure drugs to ease the situation. We curate this report.
Speaking during handoff of medicines and other supplies from AmeriCares to the Malawi government, Health Minister explains that stock levels at the Central Medical Stores Trust are currently at 5%. Catherine Nkhani attributes the development to dwindling stock levels as the last procurement was done in 2009. She says her ministry will ensure that the Central Medical Stores Trust is stocked to acceptable levels so that the country's health facilities have enough drugs. According to Nkhani, in the coming 8 weeks, the Medical Stores Trust should be adequately stocked as government is prioritizing the issue.
We have already been in discussion with Treasury, and Treasury is going to be giving us funds to ensure that we cover up for those discrepancies in terms of the funding that they had. It's been completely exhausted. So as government, what we're going to do now is to ensure that the hospitals themselves have the funding to actually do the procurement. Because what was also been happening is because of Central Medical Stores not having the stocks, the DHOs have been forced to buy from private traders, which sometimes in normal cases is usually much more expensive than them coming to buy from Central Medical Stores. So that has also contributed to their budget being exhausted before the end of the year. So as government, that's something that we've already in discussion. We'll be getting funding, and the Treasury has assured us that the gap that there is in terms of funding for procurement of drugs, Treasury is going to come to our rescue. So we'll be getting funding to ensure that we cover up for that.
Executive Director of the Central Medical Stores Trust says with a 5% stock in their warehouse, the moment the expected stock has been delivered, it will go straight to hospitals for direct consumption. Feston Kaupa, however, assures the nation that deliveries will be made at the end of this week.
We can assure the nation that we will be having the first deliveries made at the end of this week, because we are just waiting for approvals to be granted by the Office of the Director of Public Procurement, which is something that will be done between today and tomorrow, and that's an assurance that we've already obtained from the ODPP. The moment they've given us that approval, we'll straight away go ahead to award the contracts, because we are aware that there is a lot of stock outs in our warehouses, as well as dire need of drugs in the hospitals. So we will not hesitate to move with a lot of speed to ensure that these drugs are delivered. So the moment the deliveries start flowing in towards the end of this week, others have the drugs in stock in their warehouses. For those suppliers, we'll implore upon them to start the deliveries immediately.
Kaupa says the trust is in the process of floating another tender to create a buffer stock in its warehouses. Gladys Ntenda, MBC News, Lilongwe.